and welcome to Wellness Central. Is where your go-to segment for health and she's put her face in there. It's a go-to segment for wellness and well-being insights. For today, we're focusing on a topic that is very, very important and that touches on many lives. It affects millions worldwide. Is diabetes. As one of the leading chronic health conditions globally, diabetes requires constant management, and for many, it significantly impacts their daily lives. But the good news is that with the right lifestyle adjustments, diabetes can be effectively managed, whether it's through diet, exercise, or medical care. Making informed decisions can lead to a healthier, more fulfilling life.
And so joining us to unpack these are two distinguished guests, one of whom could not wait to be on camera. Dr. Owen Omo-Ojo is in the studio with us today. Dr. Owen, you're welcome. She's a public health expert who will shed light on the prevention strategies and community awareness. And Dr. Yusuf Haroun is also in the studio here with us, a medical doctor and founder Love for Health organization. You are welcome, both of you.
Welcome.
You couldn't wait to be on camera, could you? Dr.
The camera couldn't wait to have me.
I know, that's right.
Let's put it that
You're lucky
way.
this is such a light-hearted show then. Good to have you both here.
Thank you so much for coming. I appreciate you for joining us.
A very interesting topic. We've been on this all month because I think this is a month recognizing diabetes, isn't it? As well as hypertension, if I'm not mistaken. We spoke about hypertension earlier in the month. Dr. Love was here. Dr. Haroun was here. While you weren't, but it was good to have you here as we discussed diabetes. Very interesting because a lot of Nigerians are actually managing this disease. Some people, unfortunately, are on their way to doing that because of the lack of awareness that comes with the disease. So, Dr. Haroun, if you do not mind, do tell us exactly what we should know about diabetes.
So we also talked about diabetes some weeks ago.
Yeah,
when
we did
I
actually. We
talked
touched
about
on
the symptoms. You were about to take your cup and drink water, and I said, oh, excessive thirst, and you were like, oh. Yes, so diabetes is a condition where is diagnosed when the fasting blood sugar is above 126 milligram per dL, or in millimoles per liter when it's above 7 millimoles per liter. Now, there are classical symptoms in which you know if someone is diabetic, and this is what is called PPP, the 3 Ps. That is polydipsia, excessive thirst, polyphagia, excessive hunger, and polyuria, excessive or frequent urination. It doesn't mean that anyone who has these classical symptoms is diabetic, but these are some of the symptoms you find in diabetes. Also, blurred vision, weight loss, weakness, fatigue, lethargy. These are some of it. Someone can also be diabetic and have no symptoms. So we have about 44.7% of people who are diabetic and they don't have any symptom, and they are walking on the streets undiagnosed of having diabetes. In 2021, about 537 million people were diagnosed worldwide of having diabetes, and the projection is getting higher year by year.
Very interesting.
The stats are quite scary. It's quite scary. And you are a public health expert, right? And so it now puts into perspective, why are we seeing these numbers increasing? What could be the contributing factors to these numbers?
Like Dr. Love said, in 2021, there were over 500 million people who were living with type 2 diabetes, and that number has risen to over 600 million people. I just want to give some background. In Africa, of that over 600 million, we have about 24 million people in Africa living with type 2 diabetes. And in Nigeria alone, we have over 11 million people living with diabetes, and about 1 in 17 individuals, adults, would have diabetes, right? So the numbers are staggering. Unfortunately, right, when we talk about the contributing factors, risk factors and all of that, there are some risk factors that you cannot control. So things like familial predisposition. So if a family member has it, then you're more predisposed. But then there are other risk factors like obesity, lack of physical activity, things like that. But what's more concerning from the public health perspective is that we're not putting enough spending. So in Africa, just about 1% of total expenditure goes to diabetes care. And diabetes is one of the most expensive chronic conditions to manage. So there's a lot of attention, more attention is put into managing acute and chronic illnesses as opposed to non-communicable diseases like diabetes, you know, and it continues to increase the financial burden on diabetes. So
Tell you what we're going to do. When we get back, we're going to talk about the causes, and I mean that definitively, causes for diabetes, the increase in numbers in Nigeria. But what we're going to do now is go on a short, well, not a break, because it's the top of the hour and time for the news headlines. Judith is going to bring that to us. And when we get back, we'll continue this discussion here inside of Wellness for as we discuss diabetes. Do stay tuned. Welcome back on Wellness Central here inside of Breakfast Extra. Myself and Judith, we have guests in the studio. Of course, we have Dr. Haroun and, of course, Dr. Omo-Ojo with us, and we have been discussing diabetes. As we celebrate or actually acknowledge a month of, well, diabetes here in Nigeria and the world, we are also giving tips, perhaps, on how to manage and talking about the factors that cause such high numbers when we look at the Nigerian situation. Dr. Haroun, before we went on a break, I told that when we get back, I want to talk about the specific nature of what causes those large numbers in a country like Nigeria. I am of the opinion, and I might be wrong, that the wealthier a country is, the more diabetics you find inside of that country. I see you wagging your head, but hear me out for a second. This is because perhaps, look at America. They had a, what do they call it, a pandemic, about obese pandemic. They've had that for a couple of years now because everybody seems to be getting, you know, having diabetes.
All right.
Now, I'm factoring in the rate at which they consume fast foods, and I'm wondering whether that is a factor here in Nigeria, and whether it will go away now that nobody can afford fast food anymore. I don't know. But do tell, are these resultant, are these factors?
No.
They're not?
Yes. When I was in the US, a prevalence was done for those who have diabetes. It was the high income earners. They have about the prevalence of 6%. Whereas compared to Nigeria here, where I've seen a prevalence of 14%, and we still have about 47% of people with undiagnosed diabetes. The reason is that those who are healthy, they watch their, who are wealthy are also healthy because they watch their weight more. They also go to the doctor, they have health, they can afford medical care, they can afford treatment, they can go to the gym or exercise, they have knowledge and information about diabetes. Those who are low income, they don't even go to the hospital, so they don't even know that they are diabetic, so they have not been diagnosed. They can't even afford, as doctor said, they can't even afford treatment for diabetes. Unfortunately, I remember when I was in a hospital here in Nigeria, a young girl died of a complication of diabetes called DKA, diabetes ketoacidosis. It's a condition where you have severe high blood sugar, hyperglycemia. It could even affect the mental state. The person could go into coma, and the person might eventually pass away. So she wasn't given insulin on time. At that time, I'm talking of about 15 years ago, insulin was just about 2,000 naira then. They couldn't afford it, compared to now where there is inflation and the cost of insulin is far more than that. So low-income earners have higher prevalence of diabetes than high-income earners. Because
of a lack of awareness.
Lack of awareness, lack of wealth or lack of income to take care of themselves, to eat good food. We talked about starchy foods. There's another thing called GI, glycemic index. These are what causes, or these are one of the risk factors to diabetes. Glycemic index means things like gari. They have higher glycemic index, above 55. Gari, starch, bread, rice. Now, wealthy people can afford food like beans, meat, fish. They can eat varieties of fish, olive oil, things like that with lower glycemic index, nuts. So poor people cannot afford this kind of food, so they go strictly to starchy meals only, and they have a risk to.
All right. Hang on there. Dr. Omo-Ojo, how are individuals in the public health sector addressing this very interesting dynamic here that he's just mentioned between the rich and the poor and what they consume and how it affects their health?
Okay, so In public health, there's something called social determinants of health, right? And those include your socioeconomic status, so your wealth profile, your educational background, you know, how well are you able to absorb information, so educational level, things like that. And so with those in mind, you cannot take away their social determinants of health. So they're the things that will determine your health outcomes, right? And so to what Dr. Love was saying, you know, the more money you have, the more options you have. You're able to get access to information. The more educated you are, obviously, you're able to absorb this information. And so I think with from the public health perspective, a lot of advocacy is on preventing the disease in the first place, because we know that treating is extremely expensive. And so from a public health perspective, a lot of advocacy is going into preventive measures. And that's part of the reason why we celebrate Diabetes Day every 14th of November, right? And it's at the forefront of WHO. Another public health perspective, a lot of advocacy has been on multi-stakeholder engagement, understanding that just one stakeholder cannot do it alone. So you can't leave it to just government. Yes, it's important that we increase our expenditure. Government increases. I mean, the NHS in the UK, they spend about 10% of their annual health budget on diabetes, you know, as opposed to a staggering, 1% in Nigeria, for example.
Right.
And so there has to be multi-stakeholder engagement. Government needs to increase funding, budgetary allocation to managing diabetes, training personnel at the primary healthcare center, strengthening primary healthcare to ensure that, they're able to promote prevention, to diagnose and to treat diabetes at the primary healthcare level. So very important. And then private sector as well. We need to, there's so many initiatives that it can come up with, like, for example, what Lagos State is doing now with the Know Your Numbers, initiative. Yeah, so, I mean, it's so important to engage with private sector as well, to institute CSR programs that target, diabetes awareness, diagnosis and treatment.
There's another thing I would like for us to talk on, which is nutrition, which was part of his earlier submission from Dr. Love, Dr. Yusuf there, and nutrition plays a significant role in diabetes management and prevention. So, from a public health perspective, right, what are some key dietary changes, given the soaring cost of living crisis that we're in, and the price of food? What are some key dietary changes individuals and families can make in this time?
So improving fiber intake and reducing your intake of foods with a higher glycemic index, like Dr. Love had mentioned. So eating more, if you know that you're predisposed. So again, it goes back to education and prevention, right? So creating awareness. If you do not know, if you simply do not know, you just don't know, right? And so it's understanding the predisposing factors, especially for people who have that family link to developing diabetes. You already know that you have that tendency to develop, or you have the risk factor, right? It's important that you increase your fiber intake, more fruits and vegetables, fruits that have a lower glycemic index as well, and vegetables, more of green leafy vegetables, proteins, food that is high in proteins, high in fiber, as opposed to eating. So if you know that you have those risk factors, it's important that you increase your vegetable intake and reduce your starchy food intake. But I think beyond diet, physical activity is one of the most important factors to reducing the risk of diabetes. Physical activity, at least 30 minutes of physical activity daily, about 3 to 5 times a week, is really important.
So I guess the government is onto something where the cost of transportation is high now. We're walking about. But Dr. Love, regarding the poor state of things in Nigeria, what advice do you have for people, low-income earners, since it seems that is the focus, because that's where these numbers prevail, the prevalence is high there. What advice do you have for people who don't even know what status they are?
Yes, this is why social determinants of health, as the doctor said, is also correlating with SES, socioeconomic status. So SES is a key factor in determining one's health. And this research was done in New York when I was in Adelphi University. So what I would advise people with low income, they can still live a healthy life. It's their choice of food. Number one is that they should reduce carbs, excessive carbohydrate intake. That could be a risk factor to them. They should increase
I'm
nuts.
so sorry.
Okay.
But when you say that, it's like you're telling them,
Not to eat rice.
you guys should just stop eating.
Especially
Yeah,
when we're
I
in the
mean,
rice
Because
economy.
rice,
Yeah, I mean,
carbs,
like-
gari, carbs, and these are the staples. These are things that people fall back on because there's no money in town. You
Those are
can't
the
afford
cheapest
beans
staples
anymore. How
and the
much
most
is
accessible.
a lodo or a pint of beans?
Oh, I
now?
don't-
Very expensive.
So this is where the government has to come in. For example, two countries which I have practiced, US and Saudi Arabia, they have government support, food stamps in the US. In Saudi Arabia, health is 100% free. In Canada also, it's completely free. So now this is an opportunity for us to talk with the government, public health, and especially those in the government, that they should try and supplement or subsidize food, particularly healthy foods for people, so that they can
Sorry,
eat.
can I say something? I think
Yes.
there's actually a senator who is currently trying to push a bill for food vouchers.
Exactly.
You know, and so I think that's something that could help, because if you have, you know, food vouchers, maybe, you know, you could make it more accessible for like proteins or healthier meals,
Healthy
right?
food vouchers.
Yeah, healthy
because
food
some people
vouchers.
might use the same voucher to just purchase unhealthy food, and
Yeah.
that might cause obesity.
So much to unpack, so much to discuss, but the conversation doesn't end here. It must continue. We must continue to raise awareness when it comes to health conditions like this, managing diabetes, spreading awareness, understanding what your numbers are, knowing your numbers. And this is a call to the government and, of course, to the private sector as well, to collaborate together to help in improving the health of our nation and the population. Our guest today has been Dr. Owen Omo-Ojo. She's a public health specialist, a doctor. We also had Dr. Yusuf Haroun as well, medical doctor, who joined us here to just give us more insight on diabetes and raising awareness. Lady and gentlemen, thank you so much for coming.
Thank you
Thank
so
you
much
very
for
much.
having us.
Thank you.